Assalamualaikum warahmatullahi wabarakatuh. My name is Amatullah, and today I will presentation about diabetes. First of all, what is diabetes? Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. For the specific explanation, I put it on notes. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cell to be used for energy. Sometimes your body doesn't make enough or any insulin or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cell. Next, type of diabetes. It's what are the different types of diabetes. The most common types of diabetes are type 1, type 2, and gestational diabetes. For type 1 is diabetes basically the type 1 diabetes is an autoimmune disorder, namely a condition when antibodies that are supposed to work to protect the body against infection instead turn to attack the body's own cell. For the type 2 diabetes, unlike the cause of type 1 diabetes, which is the result of decreased insulin production. In type 2 diabetes, insulin production runs normally. For the specific explanation, I put it on notes too. It's in the case of type 1 diabetes, the beta cell found in the pancreas are destroyed. This process damages the beta cell that produce insulin. It is not yet known what causes antibodies to attack pancreatic beta cell. However, many experts believe that genetic factors and certain viral infections are the cause. However, the body sensitivity in responding to blood sugar level decreases so that its use is not optimal. Generally, this condition is more common in adults, especially those who are over 30 years old. Lifestyle factors such as lack of physical activity, stress, and consumption of high sugar food play an important role in the development of this disease. In addition, genetic factors and obesity, which are not handled properly, are quite influential in increasing the risk of type 2 diabetes. Next, gestational diabetes. Gestational diabetes is a diabetes disease that is generally temporary. This disease will attack pregnant women and will usually heal itself after giving birth. For the specific explanation, I put it in notes too. Although it can occur at any time, this disease usually begins to attack in 24th week of gestation. Although it can heal itself, it does not mean the gestational diabetes is not dangerous. If not treated properly, this disease can increase the risk of babies being born with excess weight, premature birth, or being born with low blood sugar or hypoglycemia. For pregnant women. Gestational diabetes has the potential cause complications such as preeclampsia and hypertension. In addition, the mother is also at risk of developing gestational diabetes in subsequent pregnancies, which can increase the potential for type 2 diabetes after childbirth. Okay, next is factor of diabetes. First factors is factor of diabetes mellitus based on anatomical, physiological, and biochemical change. The explanation is diabetes risk increase with age, especially at the age of more than 45 until 64 years, because at the age an increase in glucose intolerance begins, change start from the cellular level, continue at the tissue level, and finally at the organ level, which can affect homeostatic function. This results in one of the activities of the pancreatic beta cell to produce insulin to decrease, and the sensitivity of the cell also decrease because in old age, the body physiological function decrease due to decreased AA secretion or insulin resistance, so that body ability to control high glucose is less than optimal. Next, in factor, the factor in the next X is based on gender. So, what is diabetes mellitus based on gender? The result of the research are based on gender factors, namely women as many 72 respondents, 61%, and men with 46 respondents, 39%. According to Irawan, 2010, women are more at risk of developing diabetes mellitus because physically women have a greater chance of increasing their body mass index. Postmenopausal monthly cycle syndrome, premenstrual syndrome, which make the distribution of body fat easy to accumulate due to this hormonal process, so that women at risk of suffering from diabetes mellitus. Next, third factor of diabetes mellitus based on heredity. According to the CDC, the people who have one or more family member, either parents, siblings, or children who suffer from diabetes mellitus, are more likely to suffer from diabetes mellitus than people who do not have a history of diabetes mellitus. And then the last is factor of diabetes mellitus based on food patterns. The specific explanation, I put it on notes too. Next, ways of handling diabetes. How to handling diabetes? First, limit the number of calories launching the pocketbook. Second, pay attention to the type of food ingredients. In addition to the number of calories, the choice of food ingredient should also be considered. Cholesterol input is still needed, but don't exceed 300 milligrams per day. Meanwhile, seek sources of fat derived from vegetable material. Next, make sure to consume fiber. Next, choose the right exercise and do it regularly. Drink a lot of water. Choose food with a low glycemic index. Control your stress. Monitor blood sugar level regularly. Get enough sleep. Eat food rich in chromium and magnesium. Okay, next slide is how to prevent diabetes properly. First, exercise routine. Second, maintaining weight remains a problem. Next, implementing a whole diet. Do regular blood sugar checks. Manage your stress. Diligent drinking water. Maintaining optimal vitamin D levels. And the last is stop smoking habits. So, that's all for me. I'm sorry if have a mistake. Wassalamualaikum warahmatullahi wabarakatuh.